Good morning, dear colleagues. This is Dr. Luca Del Carlo speaking from Venice, Italy. I hope you're doing well and you have a nice day today. My intention is to present the new book we've been writing to our colleagues who have, many of them, more than 30 years of experience and skill in implant dentistry. And the title of the book is Advanced Implant Dentistry Multimodal Approach. This book speaks about different implant techniques working together to give the patient the best outcome. This is the sense of the book, and the authors are many from Italy, me, Pasqualini, Rossi, Mondani, Moglioni, Del Carlo Zeno, Bellotti, Grechi, Crivetto, Grechi and Maria, and Mike Schurman from the United States and Funda Goker from Turkey. There are many chapters in this book. After an introduction in which we speak about the principles of implant dentistry and the common implant techniques, we go and deepen different implant techniques which can support the common activity in the interest of the patients. And then we go on with some protocols very easy to perform that colleagues can perform in their offices. And then we go on with sinus augmentation, superiosteal implant, and zygomatic. In the beginning, there is written something about the implants most commonly used and the fact that many studies have been deepening the fact that implants have got the same response from the bone if they are properly used and they have the right shape, of course. We talk about the important function of the tongue and the risks that during swallowing the tongue can cause due to the expansion, which can jeopardize implant stability. There is one entire chapter about bicortical implants, in which we talk about these thin screws that in situation in which there is a rigid thin and the mesiodistal space is narrow, they can resolve a lot of problems because we can bend them, exploiting the property of the grade 2 titanium. We give the new dentists who are approaching surgery now some suggestion to behave in the right way about the incision, about raising the flaps, the correct indications and protocols to use correctly the implants. There is an entire chapter about intraoral welding, which can be used to connect the implants by a titanium bar as a temporary solidarization, or, as you can see in next slide, as a definitive solidarization. This helps us a lot in many situations. For example, when there is no bone in the buccal side, to stabilize a screw with a thin cylinder of titanium by welding them together, going with a thin cylinder to exploit nearer areas in which the bone is deeper. This works very well, and we describe it in the book. In the book, the subject of the blade implants is deepened, and the fact that they are really useful in thin ridges in many situations is well described with all the protocol to use these implants in proper way. And this is in the book. The blade implant can be bent, as you see at left, and it was put in the proper way, in deep in the slot, so as to let the gums surround correctly the abutment with the biologic width. At right, you see an example in which screw and blade together can be used to be the new root in the place of an extracted modal. An interesting technique called endorsed distance extension with ramus implants, blade implants, is described in an entire chapter of the book. In the book you can find also chapters about the last technological techniques like intraoral scanning, CAD/CAM, and surgical guides. Computer is protagonist of our profession now, and this is well described in the book. And these are the protocols. Another protocol is the one which is based on the use of post-extractive submerged implants between the teeth with a technique and proceedings that let the patient arrive to the final prosthesis, always being provided with a well-working temporary prosthesis. Another protocol is the one in the situation in which there is an important severe resorption of the upper jaw, in which we insert two submerged implants in the posterior extremity of the upper jaw, and then after some months we treat the premaxilla with implants and we connect to the posterior implants inserted before. This is the Auriga protocol we use since more than 20 years, which works very well, and it is described in the book. An entire chapter of the book is dedicated to the sinus augmentation procedures, analyzing the anatomy, analyzing the best techniques to get the best outcomes, with the support of CBCT and diagnostic best apparatus. The superiosteal technique for patients who have been having a resorption of the upper jaw, complete resorption, is described with a case which shows the best way to perform the surgery and to build this kind of implant. The last chapter of the book is about the zygomatic implants, and this chapter is letting you know how to work in the right way, how to choose the right technique to get the best result with this difficult technique, and to get the best position of the implants, to let the implants be at the center of the ridge and get them the best prosthesis. So this was the description of the book. I hope it has been interesting. You can find this book, Advanced Implant Dentistry, the Multimodal Approach, in the most common bookstores that you can find in the world. Thank you for your attention from Dr. Luca Del Carlo, Venice, Italy, and I hope you have a very nice day.